So hello, everyone. Welcome to the information session for the new online professional certificate program stream in health terminology standards launched by the School of Health Information Science in partnership with the Division of Continuing Studies at the University of Victoria. My name is Francis Lau. Here I am, and I'm the faculty coordinator of this program. Before we begin, I would like to acknowledge and respect the Algonquin peoples on whose traditional territories the university stands, and the Songhees, the Esquimals, and the Wasanich peoples, whose historical relationships with the land continues to this day. In the next 15 minutes or so, I will provide some information on this new certificate program stream and on how it can help advance your career. Please note that we'll be recording the presentation portion of this session. During the session, if you have any questions, please type them in the chat box or raise your hands, and we'll be glad to address them. So what is this program? In 2018, the school introduced a graduate certificate program in health terminology standards. The admission requirement for that program stream is that applicants are required to have a 4-year university degree. Since that time, we have been planning a second program stream aimed at people who have a health information management or HIM diploma without the university degree. Our planning effort has led to this new program stream called the Professional Certificate in Health Terminology Standards. The stream is for people with a health information management or HIM diploma, plus 2 or more years work experience in the health industry. This professional certificate is a 1-year part-time program with 4 courses done through weekly virtual classes and a 2.5-day virtual workshop in May. And it's pretty much the same as the graduate version of this program, except it's for people who have a HIM diploma. Folks who graduated from this professional certificate stream will be eligible to apply for the CTSS credential from the Canadian College of Health Information Management, or CCHIM, which is part of the Canadian Health Information Management Association with 4,000 plus practicing HIM professionals across Canada. So here's an overview of the program, which is jointly delivered with our partners, Accenture, Canadian Institute for Health Information, or CIHI, RKL Informatics, Ontario Health Digital Health Standards, and Canada Health Infoway. They're all industry leaders in health information standards in Canada. So there are 4 courses to this program. The first course is the Health Information Science, or HINF 535, on health information standards, done over 13 weeks starting in September. This course introduces you to different types of terminology standards for capturing clinical events such as diagnoses, findings, assessments, and medications, and data exchange standards for sharing patient information through electronic messages and documents. There will be hands-on learning activities and term papers so you can apply the concepts learned in case studies. The course is co-taught by subject matter experts from Accenture and CIHI. The second course is HINF 536 on controlled terminology standards, also done over 13 weeks starting in January. This is where you will learn more about specific terminologies, mainly SNOMED CT, which is a reference terminology for diagnoses, clinical findings, body sites, organisms, etc. You will learn how to use these terminologies, such as creating subsets, extensions, cross maps, and querying patient records. You also learn about how to implement and support these terminologies in health organizations. The course is taught by Dr. Dennis Lee from RKL Informatics, who is a graduate of our school and a practicing health terminology specialist. The third course is HINF 537 on health information exchange standards. It is done in a compressed format over 6 weeks. In addition to the weekly online classes, there's a 2.5-day intensive virtual workshop in the 3rd week of May. The course will introduce you to real-life standards-based healthcare applications and case studies for such areas as immunizations, medications, imaging, lab tests, and clinical reporting. The emphasis is on the appropriate use of terminology standards in these healthcare applications. The course is co-taught by subject matter experts from the Ontario Health Digital Health Standards team, Accenture, Infoway, and CHI. The final course is HINT 597, which is a capstone or field project done in 3 months from June to August. This is where you will apply what you have learned in the previous 3 courses to work on a practical terminology-related project. The course includes an evening seminar series in June on latest developments in health information standards, again, delivered by subject matter experts in the health industry. Now, the admission requirements are those with HIM diploma and 2 years plus of related work experience, and graduates are eligible to apply for the CTSS credential, as mentioned earlier. So we mentioned about CTSS. This is the Certified Terminology Standards Specialist designation granted by Canadian College of Health Information Management, that is the accreditation body for Canadian Health Information Management Association, or CHIMA, with the 4,000 or so certified health information management or HIM professionals who work in the health industry. Now, by completing the certificate program, you'll be eligible to apply for this credential without any further examination. Increasingly, employers are starting to list CTSS as a preferred destination when hiring HIM professionals to support electronic health record, health information exchange, or terminology-related projects. Now, here are some examples for the 597 field project course. The topic is typically framed with within a standard life cycle, as you see on the right side here, which covers needs identification, specification, development, deployment, and maintenance of a particular standard or application. Some of the example projects that you may work on would be for needs, such as identifying requirements for specific terminology for use in the health organization, to develop a business case for specific terminology for health organization, or to analyze local clinical term coverage and usage. And then for specification, it could be to analyze or evaluate controlled terminology governance options and to develop recommendations, or to analyze terminology specifications for a specific health information exchange standard being developed. Or it could be to develop specifications for structured data entry and retrieval template. For development, it could be to map local drug terms to the Canadian Clinical Drug Database, or to create a specific SNOMED CT subset for a health organization, or to create a SNOMED CT education program. For deployment, it could be to create an implementation plan for a specific terminology in a health organization, or to develop an end user engagement strategy for an organization in the process of adopting a particular HIE standard. And finally, in the area of maintenance, it could be to develop an HIE or health information exchange maintenance plan for an organization with a focus on terminologies, to evaluate quality and use of a specific SNOMED CT subset for a health region, or to evaluate the impact of a specific terminology subset on the quality of care. So how does this program help your career? Well, as I mentioned earlier, upon completion of this program, you'll be eligible for the credential of CTSS from the Canadian College of Health Information Management, or CCHIM. With the knowledge gained from this certificate, you can work on all kinds of terminology, standards, health information exchange, and interoperable electronic health record related projects. And often you become the go-to person within your organization for projects that involve these terminology standards. And here are some examples of recent initiatives underway in Canada, just to give you a flavor of the kind of projects that you may be involved in. First is the standards resources for COVID-19. Another one is patient summary, the Canadian specifications. And the third one is digital health information exchange regulation. So with standards resources for COVID-19, as the first example, it is to support COVID-19 management in an organization such as a health authority. Canada Health Info, as you see on the screen here, is the national organization that maintains all the terminology standards for Canada. These include all the codes that are needed to document COVID-19 related terms, such as the virus names, the clinical conditions, the lab tests, and the treatment and interventions involved. As a terminology specialist, you will be helping to maintain lists of these terms as value sets to ensure they're accurate and up to date within your organization's electronic health record and information systems. The next one is the patient summary, the Canadian specifications. The patient summary is a document with essential health information on an individual defined in a way that can be implemented as an electronic record extract for secure exchange, data exchange between organizations. The Pan-Canadian Patient Summary is based on the International Patient Summary, or IPS standards, initially developed to support cross-border exchange of health information, such as allergies, problems, medications, vaccinations, results, and procedures, and many more. And in fact, some Canadian jurisdictions have started to extend this Pan-Canadian standard to support regional and local exchange of patient information electronically between organizations. At the policy level, if that's what you're interested in, the latest development is the introduction of DHEX, or the Digital Health Information Exchange Standard in Ontario, in the province of Ontario, which provides a regulatory framework for Ontario Health to define and implement health information standards and requirements for use in interoperability specification. This is to help ensure all electronic systems and tools can share patient health information meaningfully across organizations, EHR, and information systems. So if I want to learn more or to apply to this program, where do I get more information? Well, the place to start is the website hosted by the Division of Continuing Studies, which is a partner in this professional certificate program. And here's some key information for you to consider. The application deadline is August 15 for September entry. We know it's a little bit late, but it took us a while before we can launch this particular program. So we're wanting to offer it for this September entry term. So we're thinking of sort of opening up the application deadline till August 15 to allow applicants to apply for this program. The website I just showed you has information, overview information on the program, and also admission requirements, such including how to apply and tuition fees. You can also contact us directly. So for application process related questions, you can contact Susie Torres at the email address listed. And for program and course related questions, you can contact me, Francis Loud, at this particular email address. And here's the Continuing Studies website that describes the program. And you can also find more information on the CTSS credential from the Canadian College of Health Information Management website. We know it's a lot of information. So after this information session, we'll be posting the slide deck and the recording of this session on the school website and also the division website. So where you can find where you found the information session link earlier to attend this session, so you can have that information readily available should you want to apply for this professional certificate stream. So we will now open it up for any questions or comments that you may have.